Good morning, I'm Frank Powers, and this is Lifestyle Tucson, the program where I speak to our neighbors, the people behind the scenes of our amazing organizations, small businesses, and nonprofits. Our friends are informing you how they serve our community, and they are here to give you updates on future projects. Let's make some new friends today. Since 1938, April has been declared as National Cancer Control Month, a time to raise awareness, promote prevention, and support those affected by cancer. Today, we're going to be shedding some light on the importance of cancer control, what it means, how it saves lives, and what we can all do to reduce our risk. We all know, and it's an unmitigated fact, that an apple a day keeps the doctor away. But let's do some myth busting too, because there's a lot of bad apples out there spreading misinformation or maybe dated information at the very least. No worries, because today I have an appointment with Alejandro Recio. Did I do that well enough?
Yes, you did.
All right, not too shabby. He is the leading oncologist with Banner University Medicine. Let me just ask you the right way and the way I know how to do it. What's up, Doc? How are you doing? Welcome to Lifestyle Tucson.
Thanks for that kind introduction. I'm doing great, thank you. I'm fascinated to be here. This is the kind of things that I love to do. I do it in Spanish, I do it in English. I enjoy it very much. I'm going to introduce a little bit of myself so you know how much I'd love to. Okay, so my name is Alejandro Recio. I'm a medical oncologist. So I was trained in Mexico. I did research in MD Anderson, Houston. I did some more studies in New York City. And then I was looking for a place that I could stay and find Tucson, Arizona as the best place to do my specialty, which is hematology and medical oncologist. But soon I understand and learned that there is a lot of people that I could help that were not here, my Hispanics and friends, and I could do it in Spanish. So I started putting myself in the community outreach and engagement office of my cancer center, which is a comprehensive cancer center, which kind of has every cancer center that you can think with a specialist. And I do, in this kind of cancers, I do mainly what we call genitourinary, so anything that means from kidney, bladder, prostate. I do it on a daily basis, and I go around the community, I think I know all the counties in Arizona now, and I have given somewhat a sort of a talk about cancer, talk about any cancer prevention, talk about clinical trials, vaccines. So this is what I like to do.
That's awesome. And it's important to do that because being a big community member is what Tucson is. It's the best. I always call it. It's the baby bear's porridge. It's just right. And that's why the networking works, but also why someone like you gets to know all the counties, get involved with everybody, and also doing it for everyone here when it comes to our Mexican friends. That's important because there's not enough bilingual stuff going on, even though we are right here in Tucson, no matter what. So even serving that community is huge and a really big deal, and probably why it was great for you to move back to Tucson. I myself, from New York, right? I dug it. It's fine. But I moved to Tucson and I knew this was the best place to be. And I'm not even a doctor. But I know it is because the people here are great. And what you described is really a good part about it and really one of the best things about Tucson. How long have you been doing it in the area? He's a young man, folks, okay? You can't even see it.
I always, when the patients come around and they ask me, "But doctor, how old are you?"
Yeah.
I always tell them like, well, just think about it. I have been doing this for 16 years and another 16 of studies between medical schools and 1 and 2 and 3 super specialties. And then when I became an attending, a full professor or a full attending in the cancer center. So I've been doing it since 6 years. So in Tucson, since 2016, and practicing by myself since 2019.
Well, hey, congrats. And I want to get to talking because a lot of what I like to do around here when I do talk to doctors, our current community superheroes actually saving lives, we've got a lot to understand. So let's just start doing it because I got a good list of things I want to talk about. And let's just understand cancer and prevention. So in just some of the notes I was sent, it's just this fact that cancer occurs when cells grow uncontrollably, but many cases can be prevented through lifestyle changes and screening. So what is some of the advice that you have when it comes to just that first fact?
Yep. So I like to start this, as you just mentioned, our whole body is in a constant replacing new cells, right? And just think about it. They are trying to do it in millions of times, from hair growth, nail growth, skin change, but also your internal organs. All these nice things that are inside your body are trying to be new every day. So if you have millions and billions of new cells coming up or new changes and you commit errors, there's going to be one that is not going to be fixed. And that is the first step. And if you commit a second error, that's what we call the double hit, now you have two errors in the same place that will kind of prone to make cancer. These errors are called mutations. Now, how do we make more errors? Because we can make error naturally and our body will correct them. We have our own system is so privileged, that so smart that it will correct errors. But let's say you are constantly causing more errors, like exposing yourself to the sun. Yeah, now you're getting your skin, now trying to correct all these sunburns a lot and a lot and a lot. And they're going to try to correct all of them, but you're more prone to commit errors. Just by definition, you are like billions or more times to commit an error. Same as smoking. You're smoking, your lung is going to say, okay, first time I'm going to deal with it, but second time and the third time. And the more you smoke, the more chances you're going to commit a bad error in your body that is not going to be corrected and it can cause cancer. And just thinking that like every time in your body that you expose them to something that can make more mistakes, more errors, more inflammation, more irritation, just put something that constantly is happening. So that's how we try to prevent it. Avoid the constant exposure to things that makes your body too overwhelmed by errors.
It's a simple fact. We all kind of know these things to avoid. Obviously, cigarettes, a big part of it, avoiding tobacco. Getting your physical activity up, always healthy for every reason. But one thing that we were just talking about, and it's something I discovered, is like alcohol does lead to cancer. I didn't know that at all. I thought that alcohol is just alcohol. It's not going to contribute to cancer. But I just found out the Surgeon General says that yes. Can you clear some of this up for me?
Yeah, most definitely. When the Surgeon General comes with this recommendation, he's thinking as a whole community, as the benefit of a whole nation, right? And there was a kind of a misunderstanding on underplaying the effects of alcohol and some myths behind it that alcohol could be very beneficial. And it can be true both ways. Let's just say this. But when you tell everyone that alcohol is good, then everyone is going to start consuming alcohol. And then the next step is abusing alcohol. Let's talk about the errors, right? If you drink one glass of wine or one beer a day, your body is not going to commit that many errors. But if you are abusing and drinking 6 packs a day and a whole bottle of tequila, well, the body is dealing with a lot of irritation, a lot of exposure, and from top to bottom. I'm going to put alcohol as a context, right? So alcohol in abuse, right? You start drinking a lot, and then you get this, everyone gets a throat irritation because of reflux. You get this stomach heartburn. You get this liver overworking. You get your kidneys, all them are at full function to replace or recover from this error. So if you're constantly doing it, then alcohol is going to cause cancer, from throat cancer through stomach cancer, through liver cancer, to bladder cancer. You name it, it's just a constant irritation. Now, alcohol does have some benefits for moderate consumption. And when we say moderate, that's the definition that the general surgeons, kind of had to put there, right? Drinking a little bit for cardiovascular risk or benefit, or drinking a little bit for social integration, because we all like to be social human beings. Those are fine. What is abusing or what is not, mild or moderate consumption is what worries us the most, that the Surgeon General had to put, a warning, like, guys, we're doing it too much. I think that what he means is like, we are drinking too much. We are maybe one of the nations that drinks many more, per person. It's not you that I'm talking to you, but likely your neighbor is drinking more.
If some of this is ringing true with you, you got to actually acknowledge this, because as you spoke, I was reminded about something that I forgot that I deal with. So growing up, I have really bad acid reflux, real bad. Then it gets real painful. And I'm like, I got to do something about this. And I go to the doctors and they're like, all right, we got to get a scope down there. And I was developing Barrett's esophagus from my heartburn. And they're like, you're at a 4% risk of cancer from this. And I was shocked. And this is from, I'm not a big drinker. But I mean, junk food, and I'm not treating my acid reflux. If you have really bad acid reflux and heartburn, that's something you have to get medically checked out, because it could lead to much bigger things. And I'm like, oh yeah, that's right, I have that. That's how much I've kind of taken care of it by consuming less coffee, I was told, far less alcohol than obviously in my 20s. But being aware of it and remembering to take that pill. But that idea of like, oh yeah, have a glass of wine a day. Who stops at the glass? They're drinking half the bottle and then it goes on to more. It can lead to addiction, and that's a big important part of what you're talking about. What about some of our friends that like to smoke marijuana? Because the world has changed when it comes to that and the laws, so that's gotten a lot more casual. And I know that some of these people are vaping like all day, and they're my friends, and it's a shame. I'm like, I think you're doing it too much. Tell me about marijuana, and let's either myth bust or talk about what it is when it comes to cancer and or just smoking in general.
Definitely marijuana is, for me, it's a hot topic. There is no patient that comes and, want to know a little bit of, like, can I use it? Can I have it? Would it help? I would say kind of like my answer to my patients, okay? So the first thing it took us decades of research and, public discussion, because it was a really good discussion, putting cigarette smoking into the cancer risk, right? Now, we kind of put a marijuana to the side, and it's like, we're not going to discuss about marijuana because it's federally prohibited, it is state forbidden, so we're not going to discuss. So there was no research, no discussion, there was nothing about it. It was kind of like something that people were doing in the back. So now that it's on the front, we ask ourselves, how much do we know about marijuana? Well, for many, many decades, and I still hold somewhat true, we cannot do research in the federal government. We cannot get paid for state government to get a marijuana research about what is the risk of consuming marijuana. There's benefits for sure. To all people who are listening, I'm sure that you're finding the benefit, but you have to be aware of the risk, right? And when we talk about marijuana and cancer risk, I think about two things. The first one, it is the risk of smoking. And I go back to my initial thoughts is like, how much you're going to expose your body to anything that you are going to burn and inhale, and it's going to be hot and it's going to irritate. Take out the marijuana part. Just think about it. Take a deep breath. Inhale something very hot. Inhale something that has a lot of particles. Inhale something that makes you cough. How much harm is it doing to your inside body? How much repair does your body have to go against this? So the reason that we don't know about marijuana and cancer is not just because we don't believe it will be there. Is we need years and the decades to show that it was some harm that it was causing the cancer. As anything else, like exposing yourself like firefighters into the smoke is like anything else, like being in a work-related fume, that you are exposing your inhaled system, your airway pipes, it's just going to cause harm. It's going to cause damage. The other thing is, unfortunately, marijuana has been linked to a magic bullet, to a magic solution, right? Marijuana cures almost everything. You ask I have glaucoma, marijuana helps. I have arthritis, marijuana helps. I have anxiety, marijuana helps. And then it's like, oh, cancer, marijuana helps. And cancer of the stomach, marijuana helps. And cancer of the, the kidneys, marijuana helps. It's like putting a magic bullet. Like there is no magic in anything that we all think we do. There is limitations, there is benefit, and we just have to reasonably take it. So when a patient comes to me and they say, I want to do marijuana in already cancer, we don't talk a lot about cancer prevention because I see cancer patients. So I say to them, like, what is the goal? What are you doing marijuana for? Mm-hmm. Because if you want to do it for recreational, and you want to smoke it, it's not going to help you. It's not really going to help your lungs to suffer through this harm and the treatments that I'm giving you. If you want to do it as a gummy because you want to sleep, okay, talk responsibly, take it. Is it helping? Yes. It's not helping you. So why, like any other things, why keep going? And so we talk about the recent benefit and the goals of doing it as any other thing that we do together.
Hey, the way you put it right there is know thyself. And that goes with anything, right? Again, even the stuff that gives you heartburn, know thyself. So one thing also to know is obviously sunscreen is a big thing to do to get to protect ourselves. SPF 30 seems to be like at least the minimum. Between 10 a.m. and 4 p.m. are some of the times that you really do want to avoid that exposure. Maybe wear those long sleeves, even though it does get hot. And then there's some vaccine information about how the HPV vaccine and the hepatitis B vaccines can help prevent cancer?
Yes, I would like to say, and this is advice for young people, right?
Yeah.
I would say that this is for all the young people, and young, I would consider, have you heard that we are having now an epidemic of, it's called the adolescent and young adult. So that means that people below 50 and above 18, although, it's a discussion of how we put it, we're seeing more cancer. And it has to do for all these things that we are being exposed, right? It has to do with, being exposed more to the sun. And as you said, if you're out there and you're a young worker, I bet that you already know that you have to wear not a 30%, a 100% UV protection factor because you are more than anyone else. If you're a golfer, you have to do it. And nowadays, we recommend these long sleeve, wearing these even shirts that are made to reflect the UV, because the more harm you do to your skin is going to cause cancer. So you, as a young adult, you are preventing cancer for the future because, believe it or not, cancer of the skin is the number one cancer. So that way we have to put it outside of all cancer so we can start talking. It's like 100 times more prevalent than any other cancer that you can think, breast cancer. So we put it outside because the graph will look like 10 times higher if you put all the skin cancer.
Okay.
But young people, young adults who are having kids, vaccination is how we prevent some cancers nowadays. And HPV vaccination, I just gave a talk about HPV vaccination yesterday, and that was about, right, what age should we start? Well, HPV is an infection that we all gonna have. It's something that we cannot avoid. It's a virus that we all gonna have, and we have recognized that 99% of the cervical or women cancer of the cervix are caused by HPV, and also men. The other cancers like head and neck, tongue, other cancers like penile cancer are now HPV vaccinated. People have stopped smoking, so the other cancers are coming up. And we have a vaccine that has 100% efficacy. Gardasil 9 is recommended starting age 9, but, CDC starts saying above age 11. But you start age 9, you can discuss it with your family, with your parents. You can discuss it with your kids. It's a conversation among both sides. And imagine giving the gift of never thinking you will have, cervical cancer, never thinking that you're going to have anal cancer, you're never thinking that you're going to have a tongue cancer just because you gave a good vaccine that prevented for a lifelong. And hepatitis, as you mentioned, and we know that, there are viruses in the liver, and everyone has heard about it. I had hepatitis. What is that? A virus of your liver. There's hepatitis A, which is just kind of quick and dirty. It just makes you feel sick, but it doesn't stay there. But there are hepatitis B, hepatitis C, and there are vaccines and treatment that can prevent from the liver suffering so much that becomes cirrhotic, that becomes cancerous. Every cancer will have a first stage. Is the inflammation, the irritation, the scarring, and becoming cancerous. So imagine if we can just prevent cancer by getting a vaccine. It would be like fascinating. I would love to say to my kids, if I can prevent you 5 cancers, I'll give you 5 vaccines.
And again, that's really important to do. And getting those screenings, just regular screenings, getting your checkups, is obviously one of the best preventative ways to do it. So be aware of that. Be aware of what you need to do when it comes to yourself. And let's also just calm down a little bit, and let's also talk about something else. I got some other fun bios about you, because he's obviously a man that knows what he's talking about. My goodness, I just learned a lot. And you also scared me. I mean, I got to say, you just named 3 of the worst places I think get cancer. My tongue, what would I do? Let alone those other places, but I won't make people giggle. So tell me about this, because in your bio, it says that you really do care about movies as well. Let's humanize this doctor so that you know you can trust him. What is your favorite movie?
Oh, great question. So I always divide that in, English speaker. I'm a Quentin Tarantino fan, so I follow Quentin Tarantino. And, just come to the point that my daughter say, like, did you see violent movies? I'm like, yeah, I guess Quentin Tarantino is counted as a violent movie. But I do enjoy the cinematography that he does, the way he puts the stories together. But if we go in Spanish, I think my favorite movie has to be Amores Perros. And it has to do a lot with my favorite kind of filmmakers, Iñárritu and friends, the 3 big Mexican directors. And I would say those are my 2 favorite movies.
Heck yeah. What about television? Do you like medical shows or do you not like medical shows?
I like medical show until they start getting into drama, or they getting into like, like my friends tells me, hey, is it real like Grey's Anatomy up there in the States? I'm like, no, we all focus on working. We're not into who is with who. So
it's not Saved by the Bell on there. Who's dating who? No, okay.
No. Now the ones that I enjoy the most. So I would say to you, I always enjoy ER, and I always enjoy the mystery of House. I didn't like the approach of House, but I guess he was making a point of rare diseases and the gunshot approach. Like, let's do everything and find something very obscure, but I enjoyed them. What I'm enjoying now it is HBO Max, The Pit, and you have to see it because it brings one big thing. We all suffer through the pandemic. It brings the kind of the trauma that the emergency departments, and I kudos to them because they survived the trauma of COVID, and The Pit puts it real in the first 2 chapters, that's for sure. And I could not even dare to think what I would have done. I mean, I was in some ED, Ebola when it was in New York City, or was in the ED when I was in Mexico, influenza 2008. But COVID, was a beast.
Yeah, it was a beast. And that's why, again, it's almost why when you talk about vaccines, there's some listeners going to be like, oh, because it like demonized that word, which was never demonized before. But that's why we're talking today, and let's see how we all feel as we talk about all these important things because, science and doctors, I like trusting them. So I've got one right here in front of me. Why don't we bust some myths right now before we go back to, find out some more about our man right here? I have a question. Is there a single food or supplement that one can take to prevent cancer?
The short answer is no.
That's right.
But, I mean, many people out there are reading in the... Nowadays, we have internet to the palm, and, we can search anything. And as I'd say, like marijuana, they want to sell one magic bullet. They want a silver bullet that will kind of do everything. And when I sit with my patients, I go and say, like, let's talk about that. So first of all, I have my own research experience on that. I would say, let's sit and say, what do you think this is going to do? How do you think it's going to do it? How much we have to do of this food? And why would it be? I mean, many people are eating that food, or many people are doing that. Cancer is something that is unfortunate, that can happen. It's not something that I would like to blame anyone for doing, but it's not something that you can reverse with a special food. Now, healthy diet helps, and it comes back to the point that I'm going to make every time that I can, that is imagine that you are not eating healthy, that you are, eating a lot of fatty. Well, that puts a lot of stress in your stomach and your body. And now you put in a lot of, alcohol, and you're putting a lot of spicy that burns, and those are, kind of like enjoyable, but not healthy. Now, we know, for example, the biggest example, it is fiber, and fiber comes best from plant-based protein, or what we come from, vegetables and fruits. It does reduces the risk of colon cancer. Like, we know people who eat fiber daily, the recommended amount, will have less risk of having colon cancer. They may, but less risk. And we know that people has low fiber intake, they may get more cancer, may not. It's just trying to balance this act and making right decisions and doing healthy. So before having cancer, healthy diet. During cancer, healthy diet. Is any particularly going to save me from cancer or cure me from cancer? I don't know any, and I don't believe that there is a magic bullet, but a healthy diet, a healthy lifestyle.
I mean, it seems like that's the secret sauce here. And that's with lots of things, whether it's heart health and Cheerios, or whether it's this and fiber. Like, there's not one magic bullet, you're saying. It's a Venn diagram of a lot of little things, and there's no secret. Good eating, being healthy, exercise, all the stuff that every doctor tells us to do to take care of ourselves. And that's important. So it's not exactly like there is a secret sauce. As it is, we got to do our best. We got to eat less junk, got to get off the couch a bit more, get outside, but still avoid the sun. So dress appropriate, and make sure that you get involved and get educated about all the things going on. And when it comes to cancer research, what's new, the fact you give talks about it all the time, and people can learn about it to prevent it. That's what's really important as well. Any other myths that we should bust right here? Because again, we are coming close to the end, but I'm not in a rush. let's just bust one more. Organic foods will completely protect you from cancer.
Yeah, well, organic has become kind of the go-to for a lot of things, as a best recommendation. First, organic is good, but not everyone can afford. So I talk to my community, and it's like, I cannot recommend people in my cancer, in my clinic, in my communities, in the borders, or anywhere, like they can afford organic. Organic is very pricey. So organic is healthier, but is not the final answer. So we want better to say, hey, just do more fruits and vegetables than spend amount of money that you may not or yes afford to do organic. There is no secret. Now, we all are afraid about we're learning about other stuff. So organic comes to a level of our out of control, right? We should be asking people who represent, and I hope that we don't get too political here, to, hey, be asking all people who makes food for us to be healthier. That's how we need to advocate, right? We need to ask. We have come to the point of ultra-processed food. We have come to the point of using a lot of insecticides to grow food a lot. But now we realize that we overdid it. We need to scale it back, make it real. But daily decisions, you can do it at home. You can do your kitchen, your refrigerator can have healthy decisions without necessarily being organic, but really being healthy, right? Trying to your refrigerator should look a little bit green, colorful, right? It should not look dull and cartoons, the cartoons that comes everything on a package. So look for those bright colors, man.
How dare you look directly at me as you say that, I will say. So let's try to imagine an idea of being healthier and filling our fridge with lots of greens and lots of veggies in there. And just two more things, just because I got them right here. I got to ask you again. You're a bit of a foodie in our city of gastronomy. What's one of your favorite places to go eat?
Oh, thanks for asking. I hope that the next time I go there, I get a free meal.
He's flat out saying it.
Yes, but Cio Pepe. Cio Pepe is the best combination of Italian food and Mexican, fusion. So it's one of my best places to go. And you have to specifically ask, what kind of food are you talking about? But Cio Pepe, I'm going to give kudos to Cio Pepe. I like it.
I think it's Chef Devin Sanner. I think it is. He's the man. Another great place here. And since we are going outside, we're giving us that advice. You do like the nature of Tucson. Since being here, what's one of your favorite places to go appreciate nature here in Tucson?
Well, I have to say that I came to Tucson thinking that it's going to be very dry, and then quickly realized that there is a lot of nature. You just have to look outside and there is green. And I was impressed because when you think about the word forest, you put in a lot of, wood, trees with leafy branches. But I think that we have a forest outside there, and it's a cactus, saguaro, national forest, and I'm impressed. So whenever someone comes around, it's like, I'm going to take you to a forest, and I'm going to blow your mind how that forest look. And the best trip that I can do, it is going up the Catalina Highway, I believe it's called, all the way to Mount Lemmon, and enjoying how can I be in 30 minutes before in a desert and all 30 minutes later in, a different forest, a different place, environment. So that's my favorite highway.
Heck yeah. And remember, just always put on that sunscreen. Because today, we made friends with Dr. Alejandro Recio, leading oncologist with Banner University Medicine.
Thank you, everyone, for the pleasure of being here. He'd said leading, but I would say we have the leading side. University of Arizona Cancer Center, for all of you guys who are there, and for Banner, who is our partner in this. It is the comprehensive cancer center that represents the state of Arizona. We do everything for you guys. We serve you, the community. We do the research for the community. We have our doctors for the community. We are your cancer sites. I know you have heard about others, but we do lead as a group together. So I'm not the leading, but we are leading.
You'll work your way up. I'm not worried about it. Thank you so much for joining me today.
Thank you so much.
This is Lifestyle Tucson. Bing bong bing, no real recap necessary. I just want to thank our new friends at Banner University Medicine for joining me today. You've been listening to Lifestyle Tucson. If you're a nonprofit that would like to be on the show, email lifestyletucson@gmail.com. For more information about this program or to listen to something you may have missed, go to the Sunday Mornings page on klpx.com, kfma.com, mixfm.com, or espntucson.com. You can also subscribe on iTunes, Spotify, and Audible, or wherever fine podcasts are fighting cancer. Follow on Facebook, YouTube, and Instagram at Lifestyle Tucson, because I'm your BFF, your best Frank forever, Frank Powers. Toot toot Tucson. I love you the most.